Every year, thousands of soldiers return home from tours of duty. Since 2003, 30% of soldiers have suffered from TBI.
Traumatic brain injury, or TBI as we call it, is really coming into its own as the signature wound of these wars. In the war theater, the signature wound comes from the IEDs, or the improvised explosive devices, which are the primary way that our young men and women serving in Iraq and Afghanistan are injured, and that's a blast effect. It's literally a shock blast that hits the brain, causes the brain to contract, then the brain re-expands. So if you can think of it as a balloon collapsing down and then inflating back up, you can see that the whole balloon can be affected.
TBI has been misdiagnosed as purely psychological. However, TBI is different from post-traumatic stress disorder, because while PTSD affects the brain mentally and emotionally, TBI affects the brain physically. PTSD can be treated through therapy, whereas TBI is treated through surgery.
My first jump in airborne school, I landed without a helmet, so I never thought of it. I just drank water and drove on. In the 2 years I was in the Army, I probably banged my head more times than I can count. I had no idea what TBI was before I enlisted in the Army.
It's very difficult to deal with somebody who has a brain injury and maybe doesn't notice that they're as different as everybody else does.
I began to realize something that I might have TBI when I realized I forget almost everything. I had a hard time finding places. I couldn't sleep. I had headaches, constant migraines.
Approximately half of severely head-injured patients will need surgery to remove or repair hematomas or contusions.
This is one of the newest areas in medicine that we have, and I would say that no more than 8 to 10% of physicians throughout the country really have a clear understanding of traumatic brain injury, how to diagnose it or how to treat it.
Because the symptoms of a traumatic brain injury often do not appear until weeks after the injury is sustained, it is not uncommon for a TBI to go undiagnosed or misdiagnosed.
I know for the most part, most veterans don't think they're suffering from TBI because you're just depressed. It's part of your PTSD. In reality, they might not even have PTSD. They might be suffering from a traumatic brain injury.
It's important to have rapid diagnosis and quickly implement treatment of a TBI to prevent secondary injuries due to the chemical and physical changes to the brain. It can also minimize the cost, both personal and financial, of the injury to the soldier and his or her loved ones.
I hardly received any support from the government because I was diagnosed with mild case of TBI.
The government is so large and the Department of Defense is so large, it takes years to respond, as opposed to in the civilian world where we have to respond. And I was really pretty lucky because I was coming from the civilian world, going to their world and saying, my golly, why aren't we helping?
I think the general public definitely needs to be informed about TBI.
And that is that we have over 400,000 brains that have a traumatic brain injury, and what all of us can do to help diagnose it, to help the families who are dealing with it, and to help the person who is dealing with it. So we need to teach the nation to become patient, to become extremely helpful, and to understand what our warriors and their families are going through when they return.